So I grew up in Kansas City. My parents are actually still there. Was there until college, and then went to University of Michigan for medical school. So my dad was a doctor. I think growing up, I'd always kind of admired what he was doing. Sometimes he would take me to the hospital with him. When I was a kid, we would kind of go on rounds. And so I always just thought that seemed like just the most perfect job and kind of what I thought I wanted to grow up and be. And as time went on and I kind of learned more about what was involved with medicine and being a doctor, I knew that's what I wanted to do. One time I was on rotation on OBGYN. I knew it was a field I didn't want to go into, but I actually found it more interesting than expected. And I went with this physician one day and he did this huge surgery. And then when we were finishing up, he said, okay, now we're going to go up and do some chemotherapy too. And at the time I thought I wanted to go into medical oncology and, treat cancers. I knew that's kind of what I wanted to get into. But the fact that you could do surgery and also then do the chemotherapy and some of the other treatments, that just kind of just set off a bell, and I knew that's what I wanted to do. The job just has become more interesting as time has gone on. I think at some point you get kind of accustomed to, having a certain set of surgical skills. You kind of know how you're going to treat these cancers. You definitely get involved and invested with your patients and their well-being. But the field has started to change a lot in probably the last 5 or 6 years with newer treatments and newer treatment options. And so it just feels kind of reinvigorated. You're learning all the time. You're getting better treatments for your patients. Patients are doing better in a lot of ways. So the field has become even more exciting, I think, in the last 5 years. So it was the right choice in terms of jobs. The first visit, obviously, is very anxiety-provoking for a lot of patients, just because most of the time they do know they have cancer, or there's a suspicion that they have cancer. So they're coming in pretty nervous. And we've got a fantastic staff. I think from the front desk on, we've got really great people who try and put them in as much ease as possible, try and make sure that they are feeling like they are coming into a place that's going to be welcoming, that's going to take good care of them. And usually at that point, we kind of sit down, talk about what our findings are, and try and outline what the treatment plan is going forward. And it can be kind of very tailored per patient. I mean, there certainly are standard protocols that we follow, but for each patient, it's their own journey. And I think they want to make sure they feel very individualized, and that's kind of our job, to make sure that they know that they're with a group of people who are going to try and treat them like they would want their family members to be treated. I have found, though, that I think the patients kind of in the area that we're dealing with, kind of the Northern Plains patients, they come in, they seem to be very willing to, I think if they feel that they have a partnership with their care team, they feel very much like following kind of the directions. We have some research that we've been doing for the last several years with clinical trials, for patients to be coming 3 or 4 hours to participate in a study, potentially to get access to a newer drug. I think that reflects a lot on just the population that we're serving. And I think we're very fortunate to have patients who are very trusting, I think, who are very respectful of their physicians and their opinions. And also I think it's just a blessing for us, because a lot of times the patients are, they're at kind of their toughest point. And they're still very patient with us. They're very kind with us with all the things that they're going through. And so, I think for me as a practitioner, it's a real blessing to kind of serve this area and this community. The hospital, the staff, the patients, the community have just been a wonderful place to set down roots, to grow a family, to have a clinical practice in. I think the mission of Avera is one that speaks very much to me as well. I think being able to come in and having treating patients and trying to heal people as part of an expression of faith, I think is also very important to me. It speaks to why I wanted to become a doctor as well, some of those reasons. And so I do think that it has just been a great institution to be a part of. I think the growth that we've been seeing, the ability to branch out into different areas that maybe weren't available here 15 years ago, has just been a great opportunity and a great place to work. And I think there's always kind of this idea of Avera Nice, but I do think Avera takes very good care of patients and makes sure that they feel embraced and treated well.